this module, we will focus on the psychosocial model of mental health. In the last decades, attention began to shift from focusing on the mental impairments attributed to a person to the barriers created by society and the factors that might have negatively impacted the mental well-being of an individual to begin with. With little scientific evidence pointing to genetic markers or differences in brain function that can reliably predict or identify mental health problems, the understanding of mental health started to change. It is against this background that the psychosocial model of mental health emerged. The psychosocial model of mental health is an approach that considers psychological, social, and environmental factors when understanding and addressing mental health issues. Unlike traditional medical models that focus primarily on biological and neurological factors, the psychosocial model considers the broader context in which an individual lives. This model identifies that mental health is influenced by a complex interplay of psychological, social, and cultural factors. Societal structures and practices, as well as socioeconomic and environmental determinants, are seen as a bigger influence than a person's alleged predisposition. The psychosocial model stresses that the impact of social determinants such as socioeconomic status, education, employment, housing, and access to healthcare on mental health. It recognizes that social and inequities can contribute to mental health disparities or differing levels of support. Rather than focusing on individual impairments or conditions, this module focuses on these barriers and how to overcome them through adequate support and adjustment to pave the way to recovery. Through this model, recovery is not merely through medical treatment. Adequate recovery entails various elements, for example, inclusive policies, peer support, reasonable adjustment, and it should always be based on options, choices, and control. Crucially, this approach also notes that recovery is possible and supports self-discovery for ways to deal with mental health problems and lead a good life, one that is defined by the individual with or without what the professional calls symptoms. Recovery is a personal journey and can greatly differ from person to person. It is, however, always possible to receive support and a meaningful life included in the community. The psychosocial model acknowledges that mental health is an aspect of every human experience and that it can be influenced by various determinants. As such, a psychosocial approach considers prevention, support, and the respect of a person's rights as key in addressing mental health problems and challenges. It also focuses on collective efforts and changes to address risk factors and promote inclusion. Following this approach, persons with mental health problems are seen and treated on an equal basis with others. So in summary, the psychosocial model of mental health provides a more holistic and inclusive framework for understanding and addressing mental health issues. Moving away from a purely medical model can lead to more compassion, person-centered, and effective approaches to mental health support. In the previous modules, we have discussed mental health as a continuum and a human experience. We've looked at the differences between the biomedical and psychosocial model of mental health, and we have also underlined how the UN CRPD changed our understanding of mental health. In the next module, we will uncover what the common features of the psychosocial model to mental health is. Stay tuned.